Hello, my name is Cassandra Mendola and I will be demonstrating oral motor therapy on a non-dysphagia patient. First of all, dysphagia is a swallowing disorder. The importance of oral motor therapy on a dysphagia patient is designed to increase coordination and range of movement in your tongue, lips, and jaw, which will help your speech and swallowing function. Now, under normal circumstances, our oral muscles need no extra exercise. The act of speaking and eating each day keeps them all in great shape. But what happens when the part of our brain that controls these muscles become damaged? That is usually the first time most of us become aware of the muscles surrounding our mouth. Therefore, oral motor therapy comes in. And simply put, oral motor therapy is exercising the muscles of your mouth. The exercises that I will be demonstrating are the lip exercises and the tongue exercises. The first exercise I'm going to do is lip exercises. Lip exercises are used when the patient exhibits difficulty in keeping the bolus, which is the food material, inside their mouth. So the lip exercises would help prevent the bolus/food material from escaping the lips. Lauren is my non-dysphagia patient, and she will be demonstrating lip exercises. First up, Lauren, you will be doing lip retraction, and lip retraction is you smile and you hold for 5 seconds. So look at me, and then now you try. Okay, once again, smile and hold for 5 seconds. Okay. Next up is lip protrusion. First, Lauren, look at me, and you will pucker your lips first. I'll show you how to pucker your lips like this, as if you were giving someone a kiss. And you will hold that for 5 seconds. So now pucker your lips. Hold that for 5 seconds. 1, 2, 3, 4, 5. Okay, thank you. Do it once more again. 1, 2, 3, 4, 5. Next is lip retraction and protrusion using over-exaggerated movements. Smile and pucker your lips and do this 10 times. So like this, smile, pucker your lips. Smile, pucker your lips. Now you try. 4, 5, 6, 7, 8, 9, 10. Excellent. After that is lip press. You're going to tightly compress your lips for 5 seconds, and then you would do that 10 times. So tightly compress your lips like this. You will hold that, and you would repeat that for 10 times, but you're holding it for 5 seconds. Now you try. 1, 2, 3, 4, 5. Now I'm going to be using a tongue depressor. It's going to be a lip press, but using a tongue depressor. Okay, so I have the tongue depressor, and Lauren will close her lips tightly on the tongue depressor, and I will try and attempt to resist it from her so she won't take it out of her mouth. So I will put the depressor in her tongue, and her lips are over the tongue depressor, and I'm going to try and retract it for 5 seconds. 1, 2, 3, 4, 5. Okay? See, and as the tongue depressor is in between Lauren's lips, I'm trying to pull it, and I'm trying to, but her lips are keeping the depressor still in her mouth. And next up, we'll have Lauren puff her cheeks like this. I'm filling the cheeks with air, and also while Lauren has her air in her cheeks, she's going to move from one air from side to side in her cheeks, like, okay? 1, 2, 3, 4, 5. Last one. 2, 3, 4, 5. Okay, thank you. And that concludes lip exercises. My next exercise will be tongue exercises. Tongue exercises are used when the patient has very weak tongue movement and contraction. Also, the patient may not be able to form a bolus due to reduced range of motion or coordination. The tongue exercises will help the patient increase tongue movement and reach into the lateral sulci, which is the corners of the mouth, for food material residue and elevation. We'll have Lauren extend her tongue. First it's called tongue extension, and she will extend the tongue between lips out of the mouth as far as possible. Hold in place for 5 seconds and repeat 10 times. Like this. Okay, so extend your tongue. 1, 2, 3, 4, 5. Okay. Another one. We'll do another time. 1, 2, 3, 4, 5. Excellent. So the next exercise is tongue retraction. Lauren will use the back of her tongue, and the back of her tongue will touch the roof of the mouth as if she was producing a K sound. For example, k, k. So except she won't produce the K sound, she'll just hold up the back of her tongue to the roof of the mouth and just leave it there for 5 seconds, and she would do that 10 times. Okay, 1, 2, 3. 1, 2, 3, 4, 5. Another thing. 1, 2, 3, 4, 5. You see her mouth was open because it looked like that she was producing the K sound. When you produce the K sound, your mouth would be open and the back of the tongue touches the roof of the mouth. Next up is you move the tongue side to side. So when you move the tongue side to side like this, rotate. 1, 2, 3, 4, 5. Another time. 1, 2, 3, 4, 5. Excellent. So the next exercise is the tongue push forward using the tongue depressor. I will put the tongue depressor on Lauren's tongue, and she will push the tongue depressor towards me. So she is pushing it forward, and she will hold that for 5 seconds, and you would repeat 10 times. So 1, 2, 3, 4, 5. So you would repeat that 5 times. So let's try just trying to push it forward and holding it. 1, 2, 3, 4, 5. So you repeat this 10 times, and which will exercise the tongue to push this forward. Next up is the tongue push up. You would extend the tongue out of the mouth, and I will place the tongue depressor on top of the tongue and apply the downward resistance on it. So she will be pushing the tongue depressor up, and I will be pushing it down. So it will strengthen her tongue. So 1, 2, 3, 4, 5. Excellent. So now the last exercise is tongue push side to side. So she will push the tongue depressor from side to side, left and right. So she's basically moving the tongue depressor left and right using the tongue depressor. 1, 2, 3, 4, 5. Basically, she's sticking out her tongue and moving it left to right, which increases her tongue movement. All right, that concludes my oral motor therapy. Thank you very much, Lauren, for being a great patient. Thank you. Thank you for watching.